Did you know that your racial background can actually impact what sort of eye problems you may develop in the future? Hi everyone, I'm Dr. Saya Nagori. I'm a board certified ophthalmologist as well as a glaucoma specialist, and I have a practice in Maryland. Remember, this video is for educational purposes only, so be sure to talk to your personal eye doctor if you have any concerns. Now, the first disease I want to talk about is one that has already tons of videos on this channel, and because I'm a glaucoma specialist, and that is glaucoma. So any person who is Black or has any African American ancestry is actually at a much higher risk for primary open angle glaucoma compared to any other racial group. In fact, this population is actually 6 to 8 times more likely to develop glaucoma when compared to Caucasians. Now, in addition to the increased prevalence, the glaucoma in this population often happens earlier in life, and it can progress more quickly and often leads to more severe visual outcomes. So this is why early screening for glaucoma is so important. And because glaucoma can often be asymptomatic, if you're not seeing the eye doctor for some other reason, it may go unnoticed for many years. And we know that treating glaucoma early has positive effects when it comes to visual outcomes. Now, second, in terms of glaucoma risk, is anyone who has Hispanic ancestry. When compared to Caucasians, the rates of glaucoma are actually significantly higher in this population also, especially after the age of 60. Now, the third group I want to talk about when it comes to glaucoma is anyone who is specifically of Asian descent or East Asian descent. In this population, they are more prone to what is called angle closure glaucoma. And there's a video on this channel that talks about how open angle and angle closure glaucoma are different. And angle closure glaucoma is one that can happen a little bit more quickly and can have more dramatic consequences. Now, while these are trends based on existing data, it's also very important to acknowledge that any person of any race can get glaucoma. So it's important to have a screening done, especially once you're in your 40s. Now let's move on and talk about cataracts. Well, cataracts, as we know, will happen to everyone with time, but there are actually certain cataracts that are more common in certain populations. Caucasians are more prone to nuclear cataracts, while Asians have a higher likelihood of developing what's called a cortical cataract. Either way, there is no population that can escape getting a cataract because if you live long enough, everyone will get a cataract. And unlike glaucoma, which causes irreversible vision loss from cataracts can be effectively treated with cataract surgery. Now let's move on and talk about a disease called age-related macular degeneration, which is often abbreviated as AMD. It's also referred to as macular degeneration for short. In this disease, Caucasians here are at a significantly higher risk when compared to anyone of African American ancestry or Asian ancestry. The disease is actually the leading cause of irreversible blindness amongst older Caucasians. Now let's talk about refractive errors, specifically myopia. Myopia is the medical term for being nearsighted. Asians have a much higher prevalence of myopia, especially in Southeast Asian and East Asian populations. This is influenced by genetics as well as environmental factors like doing extensive near work. Another eye problem I want to discuss is something called keratoconus. In keratoconus, the front of the eye, the cornea, becomes abnormally thin and cone shapes. Populations that are vulnerable to this are African Americans as well as Hispanic populations when compared to Caucasians. Now again, anyone can get any of these diseases, but these populations seem to be at the highest risk. If you have an astigmatism that is getting worse, it might be important to get screened for keratoconus because there is something called corneal cross-linking now that could be helpful to treat it. It's also important to mention that if you have a family history of a specific eye problem, regardless of your race, it is more likely that you will develop that eye problem since genetics are often a strong factor when it comes to eye disease. So remember that regular eye exams are critical for all patients because early detection can often significantly improve outcomes in most eye problems. Hope you found this helpful. Remember to subscribe below, and I'll see you in the next video.